The latest health concern making headlines across the world right now is monkeypox, and there are a lot of questions about exactly how concerned we should be about this. For a little context, Dr. Ann Liu joining us now from Stanford Health Care. Thanks for being with us today. First of all, explain what is monkeypox?
So monkeypox is a virus that is similar to, or it's related to smallpox. It's a sort of a cousin, a weaker and less scary cousin of smallpox. Smallpox, as some people may remember, was declared eradicated in 1980. There were a lot of vaccinations given in the 1970s against it. And as a result, it was eradicated. And now, though, because vaccinations were stopped, we have a lot of people who are most of the population is not immune to smallpox anymore because we haven't been getting vaccinated. And smallpox vaccination confers a cross protection against monkeypox. And so now that means that pretty much anybody who hasn't had smallpox and hasn't been vaccinated against smallpox is potentially at risk for getting monkeypox. So monkeypox is a virus
that's what I was going to ask about, the fact that this has been around apparently for 60 years, but only now are we suddenly getting concerned about this. This is because the vaccines have sort of run out, or the population just has not been getting it.
Probably. And there were a lot of scientists and researchers back in when the smallpox vaccine was stopped they warned that monkeypox could have a window now to get out into the population because people weren't going to get vaccinated against smallpox anymore. It's primarily something that lives in rodents, is mostly transmitted from rodents. It's not actually mostly from monkeys. It's given monkeys kind of a bad rap here, but it was discovered in research monkeys, and that's why it was called that. But mostly transmission is coming from small rodents in West Africa and Central Africa. There's two types. The one from Central Africa is deadlier than the one from West Africa. The current outbreak around the world seems to be the kind from West Africa. And it is a virus that can cause people to feel really crummy and have a rash.
Okay, I was going to ask about the symptoms. Is that it? And how crummy are we talking?
Yeah. Yeah. So usually people start to have symptoms about 1 to 2 weeks after transmission. So there is a delay. It doesn't happen right away. And people start to have symptoms that are pretty much like a lot of viral infections at first. That's called the prodrome. They have fevers, headaches, maybe muscle aches, joint aches. They feel fatigued. And notably, they may have quite a bit of lymph node swelling. And that makes it a little bit different from smallpox and some other types of viruses that might produce rashes. And then after a few days of that prodrome, they may get this rash, or they will get this rash. And it can look flesh colored, it can be red, it can look like it's filled with fluid. The little bumps look like they're filled with fluid. They can look like they're filled with pus in different stages of the rash as it evolves. And people who have it on their mucosal surfaces, that's like in the mouth and the nose and the genital areas, it can actually look like ulcers, not just bumps. So it can cause oral pain, rectal pain, genital pain. And the lesions usually start off as painful and then can become itchy as they get sort of scabbed over. They dry up and crust over. And those scabs can still be contagious though. And so, but once all the scabs have fallen off, then people are considered no longer contagious. It usually takes a few weeks to get to that point. But depending on somebody's underlying health conditions, it may vary. So it's not going to be the same for absolutely every individual. So those are those things to look out for. There can be other infections that look similar. So just having the fevers and the headaches and the lymph node swelling doesn't mean that it's monkeypox. Just having that kind of a rash doesn't mean it's monkeypox, but it needs to all be checked out if people start to develop those symptoms.
Okay, and then is this deadly? And if so, how deadly?
So the estimated mortality, meaning the percentage of people who would die who get this, is the West African strain is thought to be about 1%. So it's not terribly deadly, but it's possible. There have so far, it's been in young populations so far, unvaccinated, not who haven't gotten the smallpox vaccination. So that hasn't been a major issue so far. But it could be, depending on the underlying health condition of the patient.
Okay. And how infectious is it, and how does it spread? How would we be able to protect ourselves?
Yeah, it spreads through close contacts, skin to skin contacts. It can live on some objects like blankets for longer, and sometimes from prolonged exposure to respiratory droplets. But it's not as contagious as SARS-CoV-2 or measles or chickenpox. Those are really pretty contagious, as we have found. But it's not as contagious as that. Usually, it requires some pretty close contact. And there have been a lot of cases that have been reported after sexual contact with somebody who is infected. But that doesn't mean that it's specifically a sexually transmitted infection. It's just that that type of contact is a close contact. But it can spread through other types of close contact.
And who is most vulnerable right now? You mentioned, people who have not gotten the smallpox vaccine. At what point in history did that sort of taper off?
Yeah. So it was the early 1970s that in the US we stopped doing smallpox vaccinations. And so most of the population is not vaccinated against smallpox. But the people who are at greatest risk, people shouldn't panic, but the people who are at greatest risk are still people who have had close contacts with or have traveled to Western and Central Africa, especially who have had contact with rodents who might be carrying the virus, or people who right now are in social circles where they have had close contacts with people who have developed this kind of a rash.
And should we get the smallpox vaccine at this point? Should we all be rushing out to get it?
No, so it's not commercially available anyway. The CDC may decide to use it on a selected basis in areas where there are outbreaks, but it's not something that you could, roll up to your primary care doctor's office or the local pharmacy and request. It's not available that way. So, but I think that, this is not going to be something that most people will need to worry about. It doesn't spread the way SARS-CoV-2 does. So, I think that we public health officials are taking a lot of measures to try to contain it and and educating the public about it so people know what to look out for.
And are there any treatments available right now?
So there's a treatment called tecovirimat that has been approved for smallpox only. It's not approved for monkeypox, hasn't been tested for that specifically in a way that would lead to an approval just yet. But and it's not commercially available. And so should somebody develop a suspected monkeypox infection, they should check it out with their doctor. It could get tested. The testing needs to be sent to the CDC, and if it's decided that this treatment is indicated, it would be in conjunction with the CDC, and the medication would probably come from the CDC. But it's not something that your doctor could write you a prescription for.
Okay, so if somebody thinks they might have been exposed, what is the incubation period? How long might you want to stay away from other people?
Yeah, so the incubation is on average 17 to 14 days, but it can be as short as 5 days. It can be as long as 21 days. So, it could be within quite a bit of time that somebody has no symptoms, that they might have already picked up the virus.
And they could still be contagious at that point, having no idea that they have it.
That is harder to say. Sometimes it's possible that they may not become infectious until much later in that incubation period. But it is something that would be of concern.
Okay. Anything else we should know about it at this point? We know things are ever changing.
Yeah, I don't think that people need to think of this as the next major global pandemic the way COVID-19 has been. But, just take care with some of your close contacts and just be aware that it's out there. It is not limited to people who are in same-sex relationships. It's not, that I think has unfortunately been some of the messaging that's gotten out there, and so we don't want to stigmatize this condition. It's not exactly a sexually transmitted infection, and just to be aware that if you haven't been vaccinated and haven't had smallpox, then we're all potentially could pick it up.
Okay, well, you have cleared up a lot of the misconceptions and made me feel a little better about all of this. Dr. Ann Liu with Stanford Health Care, we really appreciate your information.
My pleasure. It's great to be with you today.